What are the costs of fibroid removal for fertility? When considering the costs of fibroid removal for fertility, it's essential to understand the different surgical options available. The most common procedure for women looking to preserve their fertility is called myomectomy. This surgery removes fibroids while keeping the uterus intact. Without insurance, the costs for myomectomy in the United States typically range from approximately $9,000 to $30,000. The exact price can vary based on factors like the surgical approach, which can be laparoscopic or robotic, as well as the surgeon's fees, facility charges, and geographic location. For instance, laparoscopic myomectomy usually costs between $9,000 and $25,000. On the other hand, robotic myomectomy can range from $15,000 to $30,000. It's important to note that these costs do not include insurance coverage, which can significantly reduce out-of-pocket expenses for patients. In contrast, a hysterectomy, which involves the removal of the uterus and eliminates the possibility of pregnancy, ranges from about $8,000 to $25,000 without insurance. Another option is uterine fibroid embolization, a less invasive procedure that shrinks fibroids by cutting off their blood supply. However, this method is less commonly chosen by women looking to preserve their fertility, and its costs can be comparable or even higher than those of myomectomy. From a fertility and endometriosis perspective, myomectomy is generally the preferred option because it allows for the preservation of the uterus and the potential for future pregnancies. However, it is important to be aware of the risks involved, such as the possibility of fibroid recurrence and the need for future surgeries. The decision to undergo myomectomy should take into account both clinical factors and cost-effectiveness, especially if assisted reproductive technologies are being considered. Studies have shown that myomectomy can be cost-effective before assisted reproductive technology if fibroids significantly impair implantation rates or increase the risk of miscarriage. Overall, the financial burden of treating fibroids can be substantial. Direct surgical costs for fertility-preserving procedures can range from $9,000 to $30,000, while indirect costs related to lost productivity and ongoing care can add to the overall economic impact. It's crucial for patients to consult healthcare professionals to understand their personalized treatment options, associated costs, and details regarding insurance coverage. This way, they can make informed decisions that align with their fertility goals and overall health.